Hey guys, thank you so much for tuning in. People always want to know, you know, how I got here, a little bit about the business, why I chose this, why I love this so much, why I talk so much about this, why am I doing so much. So today, now we're gonna have a little in-depth conversation about me, the man behind the needle, the man behind the beauty. All right. So I definitely have some wonderful individuals here next to me, and you may hear them ask me questions here and there, but this is really for you. So if you have any questions, absolutely please. So a lot of questions, but I will start with I came out of orthopedics and orthopedic surgery, and it was wonderful. It was great. However, it was lacking something for me, the ability to really control the outcomes of my patients. Why? In ortho, it was a team. Everyone had a little bit of control, so if someone dropped the ball, then everyone dropped the ball. Here, it was just me. Everything fell on me, so I had to make sure that everyone who left my clinic looks amazing, has a positive outcome, and if it's not positive, then why and why I need to correct it. Second part of that question had to do with about why I'm in the space, and I tell you the gratitude that I get from clients on their outcomes is worth more to me than 100 of my orthopedic patients back in the day. I started around 2003, 2004. That's when Botox, it was FDA approved and it hit the market, and really people didn't know about Botox and fillers and so forth. So my job was harder. Not only was it harder in explaining what these products do, but it was harder because we didn't have a resource to go to for proper training. And that was the key. We were doing kind of haphazard stuff, getting good results, trying to figure out what was the best, what wasn't the best. We didn't have access to proper anatomy of the face. Now remember, aesthetic medicine, Botox, fillers, biostimulators is very new. It's still in the baby stages. Back then, in the early 2000s, it was all body treatments, and everything was done medically for the body, and nothing was really done for beauty except for some dermatology and some plastic surgery. Today, that's changing, where we find that the client or the human being's perception of their beauty is linked to their confidence and their spiritual well-being as well. And this is why when you have something done, sometimes you don't think about how much you're spending because you know it's going to make you feel good. And so you want to spend that money because your well-being, the way you see yourself and the way you feel about yourself is much more important than the tennis bracelet that you wanted to purchase. So your beauty is really linked to your overall health and your spiritual well-being. So nicknames are very interesting. Sometimes they're dead on accurate. Other times it just looks a certain way. So my name is Clarke. That's my last name. However, everyone calls me Clarke. And from that standpoint, I have many clients that say, so I'm coming for Clark Kent. We're Superman. And I like this, but I don't like it. Number one, because it's not just me. I'm working with their beauty, and they're already come to me with some beauty as well. I'm just kind of tinkering with things. So I'm like, maybe, I don't know, but I just don't see myself there. But I'm definitely here giving the best I possibly can. Yeah, it's very uncomfortable for me to talk about myself. But yes, if there's one thing I hear, that's what I hear. And it's really, it's my last name. I'm Clarke. You're coming to Clarke. There's something called ATP, adenosine triphosphate. So what's that? We learned that in medical school. ATP is the workhorse that provides energy to all the cells to work. And without ATP and without the intricacy of the Krebs cycle, you're not functioning. You're just a vegetable on the floor. ATP has, in my opinion, has to do with anatomy, technique, and product selection. That's the basis of my Diamond Touch technique. ATP, anatomy, technique, and product selection. Without one of those, you do not have a good outcome. So say, for example, you go to a provider and you get a procedure done, but the technique they're using is an outdated technique 10, 15 years ago, but they choose the right product and they know your anatomy. Because the technique isn't good, you're not going to have a great outcome. You may have a so-so outcome, but it's not going to be a great outcome. Say, for example, now you have the best product chosen. You also have a very good technique, but the individual doesn't know the anatomy. So you don't have a great technique. So ATP, you have to have a little bit of all of that. So Diamond Touch Technique was founded and developed around 2010 to teach other medical providers how to really get a great technique, a great outcome. And the one thing that you will notice from almost all of my clients is that they leave my office better looking than they came to my office, which means you're not leaving with unusual swelling and bruising and redness. It's not very uncomfortable. When you leave my office, if I don't see a smile, then I'm not happy. You must have a smile every time you leave my room, and that's the basis for Diamond Touch Technique, to make sure that definitely every single one leave my office happy. If they don't, then I have failed somewhere and I need to reevaluate. So Diamond Touch Technique, that's how I gain the best possible result for every single one of my patients. We're bombarded with so many products on the market, and that's a good thing, because there are many products that are not necessarily the best. Patients have to understand that different products do different things. And if you ever come across an injector, whether it's a PA, a nurse practitioner, a surgeon, dermatologist, your OBGYN, whomever is injecting you, you must understand that one product doesn't do everything. Each filler does something completely different than the other. And the more products coming on the market, we're getting products that may not be as adequate for the place it's being injected. For example, the lips. There's some products you put in the lips that the outcome looks great until 1 month. Other products will last 1 or 2 years in the lips and you look amazing. That's because the right product was chosen for you. So when you see an advertisement, don't just say, I want that product. That's not the only thing. It's the product, plus the person you went to, plus the situation that you're presenting to the injector. So the one thing that the clients have to understand is one product doesn't fit all, and the selection of the product is vital. There are other things that are just as important, and that is your injector needs to understand your anatomy based upon your landmarks. So everyone have the same anatomy, but not in the same location. Everyone have the same vessels and practically the same number of vessels, but not in the same place. And how do we differentiate where someone's artery, blood vessels, fat pads are located? That's the landmarks of the patient's face that guides you to where the valleys and the hollows and the arteries are. That requires time to learn. That requires 5 to 10 years of understanding. So I can teach a 12-year-old to inject, and 50% of people are going to love that 12-year-old. However, it's the other 50% that are going to have disastrous results. So my goal when I teach Diamond Touch Technique is to get 99% patient satisfaction. There will always be that 1% that you have to reevaluate and maybe do a touch-up, but 99% of people should always leave absolutely happy. Love that question. So what are the other things that you need to know about your face to help you make a good decision as to what you need to do? First, what shape do you have? What type face do you have? And I break it down into 4 simple shapes. What shape do you have that would render a good result? So a few shapes, and again, I am Diamond Works Med Spa, Diamond Works Podcast, Diamond Touch Technique. Notice everything is diamond. So I go with the diamond shape of the face. We have a circular shaped face. That's a circular diamond or the round diamond. We also have princess cut faces. It's like a square but with curved edges. We have the emerald shape or the emerald diamond, which is the longer Sarah Jessica Parker. So she has a longer face. That's an emerald shaped face. So different shape, and then there's the pear shape. And again, that's a diamond shape. So I love the diamond reference because it's really attuned to the person's face. Every diamond is unique. Every diamond has its own facets and angles that makes that diamond beautiful. When you take a diamond, a rough diamond, you don't just cut it into cookie cutter shapes. That raw diamond dictates, after you cut it, what it should look like. And everyone's face have a particular shape. Out of those simple diamond shapes, I can tell what that patient shape after my treatments are going to look like. So first you start with the shape of your face. If you have a round face, you can't go put in a ton of fillers on your high cheekbones. You can't ask for, I want high cheekbones, but I have a round face. You're going to have a fat face when you're finished. If you have an emerald, longer shaped face, don't go put in a robust chin. Otherwise, you're going to elongate that shape. Don't create high eyebrows with an emerald-shaped face. You're going to create a longer emerald. If your face is long, you need a more curved eyebrow. Right? If you have a square or princess cut face, that's in between. You can get away with a lot of things, but what you can't get away with is creating width within the face. I change people's face shapes every day, every single day. And I find that the individuals that love it the most are the younger clientele, below the age of 30, 35. Or individuals, especially girls, who want to get rid of that cute baby face and go into more of a natural, mature beauty, whether it's for their workplace, their clients, or whether they're just like that kind of more matured beauty look. So when they change the face, I definitely have to demonstrate to my client what it's going to look like. And based upon the temples, the temporal crest, the zygomatic arch, the gonal width, the length of the chin, the point of the chin, I can create a shape that's either more full, more round, or longer. So I change shapes every single day. It is possible to change your face shape. I think it's one of the best things I love to do because I love to rebirth the person's face. I really kind of made them into a different individual that they love. If you're looking to have something done and you're very enthusiastic about it, it's the first time, or maybe you've only done it once or twice, I will always say do not go too much too fast. If you go too much too fast, you're going to spend so much money and you just may have sticker shock, or you just may not like the final outcome, number one. Number two, most of those outcomes, if not done well, will not last long. So now you've spent 2,000 or 3,000 and 3 months later, you look the same as you did before. So do not go too fast. Do not overdo your treatments. Again, think of the journey. You want to get to the top of Mount Everest, and it's going to be a great climb. Don't just take a helicopter to the top. You're going to miss the journey. The journey is recreating yourself in the image that you want, and not necessarily the image that your parents genetically gave you. Reshaping your face and creating that image that you love, especially for men. Men lose their jawline really fast. If you watch any of my other videos, you'll see how I reshape the lower face. Men lose their jawline, the jaw angle, and the jaw width. And when you lose that, you're looking older, chubbier, rounder. So when we recreate those changes, I'm doing it not dead slow, but I'm doing it to the point where 2 years later, that person still looks good. So the one thing was say, go slow, don't overdo. The next thing, if you ever go to someone for the first time, don't do everything. First, you got to know if you're going to like their results. So if you want this, and that done, don't drop 5,000, 6,000 to get everything done. Do something small, something as simple as Botox or Dysport, Xeomin, Jeuveau. Do a toxin first. See if they get the right shape, if they listen to you, if the follow-up was good, if they really care about how you look, as opposed to a mill where you get 20 people in the waiting lobby and everyone is being done in 5 minutes. You don't want this. This is your creation. The practitioner who's injecting you should be willing to look at your pictures on your phone, look at your parents' pictures, understand what you truly want, and then give that to you. Absolutely, there's always an exception. And sometimes you have a wedding or a special event to attend, and it's 2 weeks away, 1 month away, and so you can't really wait too long. In that case, yes, do your due diligence always, but really go by the reviews. If you have a special event that's time limited, and you really need to look a certain way quickly, if you're in my hands or individuals that I've trained, you'll find that you can get a lot more done pretty fast with the right selection, the technique, and the understanding of your anatomy. So yes, if there's a special event, by all means do everything if you're certain that your money is well spent. That's not going to be achieved by biostimulators. That's going to be achieved by fillers and toxin. Why fillers and toxin? Fillers give an immediate result. There's some healing necessary, but the result is pretty much immediate. A biostimulator like Sculpture takes time to grow. Then you have different types of biostimulators. There's something called Radiesse, where you can use Radiesse that you get the instant stimulation and results, but you get that gradual, long-term, sustained result also. So of the two biostimulators I use is Sculpture and Radiesse. Both are excellent and both depend upon what that client is looking for. I've been teaching for over 12 years. I think I was teaching before some of the companies had other products FDA approved. I've been on many pharmaceutical boards in terms of looking at or bringing new products onto the market as well. I do teach a ton of toxin, a ton of fillers and biostimulators. I do not teach as much threads because threads require time for the practitioner to really get it right. And it's not just a 2-day course that does that. Unfortunately, this is what we see. Threads are a different ball game, and threads require ATP, anatomy, technique, and product selection. But it also requires another component, which is experience. I would even say and history, but experience has history. So experience, the experience to give a particular outcome using the thread in a particular space and angle. What do I mean by space? Muscle, fascia, fat, and skin. These are the 4 tissue types that threads work on. Unless you understand that, you're just jabbing and pulling, and patient may have a decent outcome, but then within 1 or 2 months, it's all gone, but you've spent your 3,000. So threads require ATP, anatomy, technique, product selection, and experience. It takes a couple of years if you're doing it regularly. So if you ever go to your injector, ask, how long have you been doing threads? But not just how long. Your injector may do threads for the past 2 to 5 years, but maybe they do one patient every 4 months. That's nothing. So make sure they do have an abundance of before and after pictures for you to see. If you cannot see the abundance of pictures, then you know that the abundance of procedures were not done. I will say that I've noticed many changes in the past, but one of the most remarkable changes is that we are finding out that it is less about the degree or degrees or certifications. It's less about the degrees and certifications, and it's more about the talent. Why am I saying that? You have practitioners who have an entire wall full of certifications and degrees. It doesn't mean they're great injectors. To be a great injector, you need to have not only the understanding, but the passion. And not only the passion, because passion without talent, you still don't have a great result. So this is passion and talent. Passion means that you're going to do this every single day, whether you're making money or not. Talent is you can close your eyes and garner a great result. So those two play a huge role in the results. They're not as invasive as surgery. They're less invasive, which means that you really just need a medical degree. Registered nurse, nurse practitioner, any MD or physician, as long as you have a medical degree in the United States, you can perform non-invasive aesthetic treatments, toxin, fillers, and biostimulators, and threads. However, because you can perform it doesn't mean, because the injector can perform it, it doesn't mean that they're good at it. There's a big difference. If you have a huge dermatology practice and you're well known, if you're very busy in your specialty, you don't need a side hustle as aesthetic medicine to inject. So what I'm trying to say is many practitioners use Botox fillers as a side hustle. There's nothing wrong with that because we all have things. This is life. But don't expect the best possible outcome, from a side hustle. Doesn't mean there are exceptions, but I will say if the passion is there, the talent is there, there's no way you have time to do another specialty. I mean, I put 40, 50, sometimes 60 hours, and that's just injecting and treating clients. I don't have time to do ER or OB or internal medicine or dermatology or surgery. If your practitioner is busy, they don't have time for Botox. And if they don't have time for Botox, then they can't be the best. That doesn't mean that you can't get a good result. What I'm trying to say is that if you want the best possible result, you've got to go to the best possible person. My heart goes out to all of the practitioners whose beginnings were very humble. And some of them started in a mall, they started in a nail salon. I started in a nail and hair salon. But I had a passion, and I wanted to make it work, and I believed in it. And I spent a couple of years not making any money whatsoever. I mean, just really, really, really scratching gravel. And so it's not more about where it's being done. It's more about speaking to the individual and understand. You know who you're talking to. When you talk to someone, don't look at the white coat or the medical degrees. Talk to the person. Is this person interested in your beauty, in your comfort? Is this person interested in your well-being, your psychological well-being? Are they interested in your confidence? Are they interested in why you're there? That's what you look at. The degrees, any medical degree can do this. Second is the talent. This is why I say don't spend all of your money within the first treatment you're doing. Do something small. See if the work was done well, if they were willing to see you on a follow-up and give you a touch-up without additional cost. Okay. The talent tells you whether this is an individual to stay with, but also read your reviews. What are the patients saying about the individual? Are they just selling the individual? Go to Dr. XYZ, he's the best. Read the reviews that tells you why. And then make that decision. Talent is out there, but talent isn't in everyone for each specialty that they're doing. There are many surgeons that shouldn't be surgeons. There are many dermatologists that shouldn't be dermatologists. There are many plumbers that shouldn't be plumbers. So always remember, speak to the person and make sure that person is speaking to you and not at you. You never want someone to tell you what beauty is and what you should look like. That conversation is between you and the injector if you're on the same level. So if someone tells you a chin should look like this, get up and run, because they're probably using one product for everyone's chin. So remember, you know what your beauty is, you know what you want. Sometimes you need guidance. That's where pictures come in. That's where discussion of your families. You know, my father have this square chin, I don't like. That is where the discussion comes in. There's so much more that needs to be included. As an injector for so many years, there's a lot of amazing things within this industry, but there's a lot of things that need some changes and corrections. And I would say the number one thing is do your due diligence. This is your hard-earned cash. This is your money that you work for. You want to make sure that it's going to good use and it's not someone else's side hustle. Outside of that, we will definitely speak of so many other things in the future, especially from the comments and questions that you're going to ask. And I'm always ready to give you the most frank and honest input. Thank you so very much for being here with me. Maybe at some point in the future, I can talk about myself a little bit more. I'm never comfortable with that. But thank you all for listening and being part of Diamond Works.